So of course, don't pitch stuff that's not something that you do. Don't lie saying you can do something because they're like, oh, if you only did this one thing, and you're like, yeah, we can figure that out. Like, don't do that. But that's really kind of how you have to do it. So that way they understand, I no longer need that place. That's why it wasn't working before. And so I can't not address this. I need you to kind of choose this. Like, you can't really have one and then also have the other, because what they could be doing could actually be undoing everything that we're doing. It sounds like you've given them a really good try, and it sounds like maybe there's still something that you're kind of really wanting to get that maybe they're not able to. But if you were to start with us from a billing standpoint, we'd have to look at that too, but also just from we want to make sure you actually get the results that you're looking for. You would need to choose one or the other, because if you have two coaches, you can't really do that. That would be like one coach saying go this way when we're playing football, and the other saying go the other way, and you're just like, I'm just going to stand here and get tackled. When you start running more marketing and when you start doing more direct response marketing, you're going to start to run into a little bit different sales objections than maybe you would if there's referrals and stuff like that. So what I mean by that is, it's not uncommon for us to do a Facebook or Google ad or something like that. And then the patient comes in, and then you're in the middle of the eval, and they're like, hey, I'm actually being seen by another therapist right now. And so if that's a physician referral, you're typically not running into that. If it's a past patient, you're typically not running into that. And so if you're going from never advertising to doing this, we need to equip our team with the right way to actually handle this conversation. Otherwise, they're going to do an eval and then never come back, and we'll just be like, oh, that was a bad lead. And in reality, we just don't know how to have that conversation because it's new. And so I'm Dr. Joey Albritton. I'm with Rehab CEOs. We work with about 275 clinics around the nation, and we've trained hundreds of providers, hundreds of front office on all this type stuff, so that way we can have better communication, help more people, and of course, also make some more money. And so on this video, I'm going to kind of break down how you can actually do this, the belief pattern that they're inherently having that maybe we're not actually thinking about, or how to just have that conversation so they just should decide to choose you versus deciding to choose someone else. And so usually this is more of a neutral tone when they kind of come in here. It's not really going to be something that's like they're going to say anything about how they hate the other place up front. But from there, really what they're thinking is like, how are you different? How is this different? Like the actual process of what you do. And what are you going to do? And will it actually work? And so right now we have to also realize what we need them to believe is that this is unique. This is different from what they've tried before, because clearly no one collects physical therapists and just tries all these different places just for the sake of it. They're looking for an actual outcome that they're not getting at the current place. Otherwise, no one opts into an ad, gets on a phone call, fills out new patient intake, comes to your actual facility just to look around. Like, that's not an existence that almost anybody ever lives in. And so we know that that's not the case. So there's something that they're lacking that we need to essentially figure out what that is. And so what we do, it's like, hey, totally get it. Sounds like you're working with someone else. It's smart that you're actually looking for actually doing things to actually better yourself to really get this addressed. So it sounds like this is really important for you and you're really doing your due diligence. So what we do there is say it's smart, so they're in the right place. That makes them feel like they're already making a right decision. You're talking about they're already looking for a solution. And when we say you're doing your due diligence or you've already done your due diligence, that means they don't need to think about it later because you've already labeled them as someone who's already done all their due diligence, so they can already make the decision. And so when we start to do that, we're going to then say, it's like, just out of curiosity, I mean, I guess, what is it that you like about the current physical therapist that you're working with? And they'll say this. And it's like, okay, so I guess if we could improve maybe some of the things that maybe you are looking for, because I mean, I assume you're not just like hopping around to every physical therapist around the city just to like chat with us. Like I feel like I'm a pretty nice guy to chat with, but there's probably something maybe you're wanting that maybe they're not able to help you get, whether that's the way they're doing it or what they're not getting you back to. So I guess for you, like, what is it that maybe you feel like they're missing? And then they'll tell you all the negative or lack of progress or the things that they don't like. So then you can actually start to have the conversation, and it's like, okay, and well, what else is it that made you actually decide to reach out to us? And then they say all the positive things they like about the other place, all the negative things about the other place, all the things that they saw that was unique enough for them to actually want to do it. So then when we pair this all together, we can then make it feel a little bit more customized to everything that is the exact solution for what they did and what they want. And so that is how we can really customize it. We call it our dynamic pillars. So we can actually present what we do in a very different light. So that way, if they're like, hey, I'm anti-needling, they just kept wanting to dry needle me, or maybe they're like, they just kept wanting to touch me a lot. They don't want manual therapy. They're like, hey, we did just literally nothing but exercises, high intensity, all this type stuff. And really, they just needed to be phased into that a little bit more. We can kind of walk through those type things to make it sure it's a little bit better. Or sometimes it's scheduling. There's a lot of different reasons that people don't like the place they're at. A lot of times it's not very logical reasons, and we kind of need to like walk them through some of those type things, but they're all usually very attainable. So of course, don't pitch stuff that's not something that you do. Don't lie saying you can do something because you're like, oh, if you only did this one thing, and you're like, yeah, we can figure that out. Like, don't do that. But that's really kind of how you have to do it. So that way they understand, I no longer need that place. That's why it wasn't working before. And I always use the analogy of fitness. So like, let's say we've got fitness, nutrition, and accountability. If I went to Weight Watchers, they're very good at accountability because you go there every week. They are good at nutrition, but there's no exercise. If I go to have a personal trainer, they're good at maybe some accountability. They've got the fitness side, but a lot of times it's very cookie cutter on some of the stuff they do. Or if you go to like a Anytime Fitness, they're usually missing something. And so it gives them the out that it's not a them issue. It's well, no wonder you weren't able to get results because insert thing that they were missing and things that you do that are different. Therefore, they're going to do that. But you do kind of have to lean in here. It's like, but I really need to make sure that we're on the same page here because every therapist is a little bit different. And so I can't not address this. I need you to kind of choose this. Like you can't really have one and then also have the other, because what they could be doing could actually be undoing everything that we're doing. It sounds like you've given them a really good try. And it sounds like maybe there's still something that you're kind of really wanting to get that maybe they're not able to. But if you were to start with us from a billing standpoint, we'd have to look at that too. But also just from we want to make sure you actually get the results that you're looking for. You would need to choose one or the other, because if you have two coaches, you can't really do that. That would be like one coach saying, go this way when we're playing football, and the other saying, go the other way. And they're just like, I'm just going to stand here and get tackled. And so we have to overcome that. And we need to tell them and actually walk them through that. It's just like a spouse objection. If they're like, well, what happens if they say no? Well, like you need to teach them how to actually have that conversation of the fact that they're looking for support and not permission. So for them, they're going to be like, this is going to be awkward. How do I actually not do this and not have to have an uncomfortable conversation? Because people don't like change. And so we have to get them to say like, yes, it makes sense. This is all actually what I need. And then it's like, awesome. So I know that like, this is maybe something you haven't ever done. Like, do you feel comfortable actually letting them know that you're going to be switching everything over so that way we can go ahead and get the records and everything like that? And they'll either say yes or no. And then if they say yes, then it's like, awesome. So make sure we do this. And you just walk them through normal. If they say no, you actually walk them through. It's like, well, what we can do is I can have our front office, they can call them, get all their notes and everything like that. So that way you don't have to worry about it. Sometimes they'll do like a $15, $20 charge for us to get that. That's not really a big issue. We'll get all that information. So that way you don't really necessarily have to do too much there. And then from there, we'll just be able to go ahead and get you scheduled for the rest of your visit. So you typically would want to take the actual burden of that. So that way they don't have to worry about it. So they're like, oh, awesome. I just have to show up. I don't have to have an uncomfortable conversation. Sometimes if the person was nice, but maybe they're just not actually good at treating, they may still want to have that conversation. So you just need to better equip them on how to have it, because what's going to happen is they're like, well, you were making progress on this, you're doing this, you're doing that. And then you have this battle of like what's going on there. And this person's trying to keep it. This person's you're trying to keep them. And that's not ideal. So you just need to walk them through how to have the hard conversation, how to actually make it to where they understand why it makes sense for them. And even if you can find a silly BS excuse that is not the actual inherent issue, if you're like, hey, I actually know that we're closer to your work or closer to there, you can use that as the reason. So that way you don't have to hurt anybody's feelings. And they're like, oh, okay, that's convenient. Yeah, I'll do that. And so hopefully this helps, because this does become more common the more you actually start to either do reactivations to past patients. We start doing Facebook ads, some of that type stuff, because they've started somewhere else and we need to help them overcome that, because again, they wouldn't be reaching back out if they were getting the results that they wanted. So if you found this helpful, or you're needing more help on sales, communication, anything like that, so that way you can help more people make better decisions, get back to where they want, avoid surgery, and make more money, make sure you join our school group where we have free discussions area. We've got trainings on all this type stuff, and we have 2 coaching calls a week. So that way you can actually have all this customized to your specific issues and things that you're having, because that is completely 100% free to the public. You can have your front office on there. You can have your providers. You can be on there. So that way we can just help coach, give back to y'all. And then eventually, of course, if it makes sense, maybe we have a conversation about working with you, but that's not really what this is about. It's starting this relationship so that way we can continue to help you as much as possible. So I'll see you on the next one.